law taking effect early next January will have a big impact on people whose blood has been contaminated by forever chemicals. The bill, signed into law early this year, requires insurance companies to cover medically necessary blood tests for PFAS chemicals.
The goal here is to help patients and doctors better understand exposure and protect their health over time. News Center Maine's Vivien Leigh has the details.
Dr. Rachel Criswell treats many patients who might have higher amounts of PFAS in their blood.
People who have a firefighting history, military vets, people who work in factories where there's PFAS used, carpet cleaners.
She is a family doctor and environmental researcher at Reddington Fairview Hospital in Skowhegan. She uses guidelines from the National Academies of Sciences, Engineering, and Medicine, which recommend blood tests for people exposed to PFAS to watch for health problems. These chemicals have been linked to issues like high cholesterol, thyroid disease, developmental delays, and some organ cancers. If the results show high PFAS levels, doctors suggest more screenings for both adults and children. The test costs between $400 and $600, which can be hard for some patients to pay.
The question often arises, will my insurance pay for this? So that is a holdup for many of those folks, not knowing if coverage is available. Reach out.
These patients are not among the 600 families who qualify for free blood testing through the PFAS fund, which is linked to contamination from past sludge spreading. However, starting in January of next year, a new law will require insurance companies operating in Maine to cover medically necessary PFAS blood tests if a provider recommends them for people who meet the National Academy's guidelines. State Senator Stacey Brenner sponsored the bill.
And so what we don't want to have happen is for people to not know what their levels are because they can't afford that initial testing.
Some people say there's still so much more to do to protect Mainers from toxic chemicals in their drinking water. More than 38% of people in the state use private wells. State Representative Dan Ankley's put forward a plan to test and filter private wells for PFAS contamination. The bill passed both houses but did not get through the Appropriations Committee.
Really clean drinking water is at the top of the human hierarchy of need, and we cannot have any gaps. It's a basic function of government.
Dr. Criswell is also studying whether an older cholesterol-lowering drug can help the body get rid of the chemicals. She is prescribing it off-label to some patients, and some have seen their PFAS levels go down. However, it is still unclear if this will help patients over the long term. Vivien Leigh, News Center, Maine.